Stroke is a common form of heart disease that has been found to be related to COVID-19. It is so common, in fact, that 1 in every 4 people over the age of 25 will have a stroke in their lifetime. Every year, there are 13.7 million new stroke cases, and 5.5 million people die from it. What is a stroke? A stroke happens when blood supply to a part of the brain is cut off by a blocked or burst blood vessel, which causes the death of brain cells. There are 2 main types of strokes. The most common type of stroke is known as the ischemic stroke, or when an artery to the brain is blocked. When this happens, it reduces the blood flow to the brain. The blockage is usually caused by deposits of fatty substances that build up in the blood vessels, or by blood clots that lodge in the brain's blood vessel. Another type of stroke is known as the hemorrhagic stroke. It is when a blood vessel in the brain leaks or bursts, and is usually caused by conditions affecting the blood vessels, such as uncontrolled hypertension and the overuse of blood-thinning medications. What are stroke symptoms? If you see symptoms of stroke, part of the brain has already been damaged and the functions that are controlled by that part of the brain have been lost. The symptoms can appear almost suddenly, and they include numbness or weakness on one side of the body, confusion, difficulty seeing through one or both eyes, difficulty walking, difficulty speaking and understanding speech, difficulty swallowing, severe dizziness, severe headache with an unknown cause, loss of concentration and memory, and loss of control over bladder or bowels. There is no reversing the damage from this condition after brain functions have been lost, so prevention is all the more important when it comes to having a stroke. There is also a mini-stroke called a transient ischemic attack that you should also look out for as well. The symptoms of a transient ischemic attack are similar to a stroke, but they usually disappear by the next day and do not cause permanent damage to the brain. But this does not mean we should carry on as if nothing has happened. 1 in 3 people who experienced a transient ischemic attack eventually experience a stroke. So it is best to look out for symptoms, which include blurred vision, difficulty speaking, sudden stumbling and clumsiness, sudden weakness or paralysis in the face, arm, or leg, sudden severe headache from an unknown cause, and sudden tingling or numbness on one side of the body. With cardiovascular diseases, such as stroke, the earlier the detection, the better. Pay close attention to unexplained symptoms. It's always better to be safe than sorry.